Great. So should I get started?
Yeah, 1 second, sorry.
No worries.
Um, Hello, everyone. Thank you so much for joining our session this afternoon. Today, we have the pleasure of hosting Dr. Ho, who will be teaching us about facial plastic surgery. As always, please remember that the Google form will be posted in the chat box and in the description of this video at the end. With that being said, Dr. Ho, you may start whenever you're ready.
Great. Thanks so much again, everyone, for having me. It was really fun to be part of Web Shouter. It's the first time. And so, I know it's been a while. Today, I'll, introduce myself again, a little bit about my background, specialty as a facial plastic surgeon, but hopefully just, go over more cases just for all of you to learn and see more of a glimpse of what I do. Please, feel free to check out more at www.drtinaho.com. And then also, appreciate the Instagram love to follow me at Dr. Tina Ho, DrTinaho. So, as I mentioned before, I'm a facial plastic surgeon in the Philadelphia area. What that means in terms of training. So, after medical school, I did a residency in ear, nose, and throat. So, essentially, head and neck surgery, having a focus here. Really enjoyed, being a specialist in that area with the delicate anatomy there, meticulous attention to detail, and also that there's a route to plastic surgery through ENT. I did my residency at University of Kansas, and then I spent 1 year fellowship in facial plastic and reconstructive surgery in Chicago, mainly in the cosmetic realm. So that equaled 6 years total of training. And as I probably mentioned before at the last time, so a large part of why I wanted to become a reconstructive surgeon was my own childhood reconstructive surgeries. I had a large nevus here that had to be removed. Think of like a large mole that could have been cancerous later. And I actually had a lot of my surgeries at CHOP in Philadelphia. So I saw early on the immediate decisive impact my surgeon had on me. I like as a plastic surgeon, even if I do mostly cosmetic procedures now, that I can really help patients look good, feel good, that immediate sense of gratification there where patients return to me and they have a big smile on their face, they look more confident, but also beautiful and natural too, that we don't others may not obviously know what we did together. And I like to be able to work with my hands, do procedures. I'm very detail oriented, meticulous. I think some of those qualities go well with being a plastic surgeon. And so now I've been in Philadelphia close to 3 years. And I'm also excited to say, and you can, see more of it on my Instagram, that I opened my own practice, my own office in the Philadelphia suburbs as of July. We had a great launch party event in September. And so just trying to build momentum. I have a couple of senior esthetician colleagues who work with me and take care of the skincare side. So, I'm really happy to help answer questions as from a perspective of a small business owner with my own practice and private practice. Also as and sorry, I might sneeze here. um, a surgeon mom. I have a son, Leo, who's close to 20 months now. So the work-life balance there. And in general, any questions that you may have regarding facial plastic surgery. And then just to give an overview of facial plastic surgery, again, what it can entail, even though it's a very specialized aspect of medicine. Reconstructive side, we cover facial trauma, patients who may break bones in their face or have lacerations that need repair. Congenital issues such as vascular lesions like vascular malformations, hemangiomas, cleft lip, cleft palate, other craniofacial issues, which I would say historically are covered by plastic surgeons who become craniofacial surgeons. Also, we are involved with skin cancer reconstruction, whether it's Mohs reconstruction or the bigger defects from head and neck cancer from smoking and alcohol use, such as doing free flap surgery, and then also facial paralysis, helping patients to achieve more functional improvement or symmetry to their face. On the cosmetic side, it includes non-surgical treatments such as Botox injections, filler, laser resurfacing, and then surgery. You have rhinoplasty and septorhinoplasty, nasal surgery that can improve the breathing function as well as the outer appearance of the nose. Your aging face surgery, such as facelift, neck lift, eyelid surgery, brow lift, and also too surgeries that help contour the face, such as buccal fat removal. Submental liposuction and injectables that can do that as well. And then the last thing to kind of leave you with, and again, happy to talk more about, being a surgeon in private practice. There's always pluses and minuses to every job. No job is perfect. For me as a business owner now, I take on a lot of other non-medical responsibilities for my practice, where as an employee you can more likely leave work at work and distinguish it at home from home. So for instance, working on the marketing, payroll, managing employees, there's some inherent challenges or headaches there. Running a practice, inventory, some of these things they don't teach you in your training as well, that you have to learn on the go or ask for advice and help from others. On the plus side, for me as a business owner, I call the shots. I can determine what hours I want to work. I am in control of my own practice, the types of patients I see, my brand, my image, even just like for my office, what color paint to put on the walls, what kind of flooring. It was refreshing when I went down this path or this next step, to have this sense of more of autonomy, independence that sometimes us as surgeons need. Also in private practice in plastic surgery, majority of my patients are healthy. I don't take insurance currently. So from a financial standpoint, what patients pay, the income is pretty stable and incentivized. I mainly work just clinic hours and operate those hours. I don't need to go around or see patients at a hospital before or after my hours or on the weekends. And currently I only take call for my own patients. So only just if an urgent emergent issues happens after hours. So it's nice from a work-life balance to not take call. So what I'm gonna do is I'm gonna share go through some cases. I want to focus on facial contouring, jawline contouring, because I feel like that has, been a niche, how do you put it, type procedure or spectrum with the patients I draw lately. And it's, become more and more popular, with the age of social media and Instagram. So let me take a look here. Okay. So, when we talk about facial contouring, I like to describe it as any procedure that can help improve the shape, definition, volume in certain parts of the face. Let me actually see if I can actually upload here. Actually, maybe just use this PowerPoint. This will probably help. So, as we're an ideal youthful face is one that is has good definition and volume, particularly in the cheeks and jawline. In female patients, particularly, this is these are patients where their facial structure follows more inverted pyramid or V-shaped structure. And so a lot of patients, whether they're younger or older, come to me to try to restore some of those features in their face so that they can achieve some rejuvenation, appear more youthful. I also like to break it down more simply for patients that any facial contouring procedure is one that that either adds or subtracts to the face to achieve that definition or shape that they're seeking. We also want to take into account that there's certain differences between patients who want more feminine or more masculine features in the face. For instance, a male patient or a patient who desires more male features, that their jawline or lower third of the face is not going to follow more that V shape, but would be more square, so that it looks stronger looking chin. But again, the commonality is that a youthful face has, ideal projection and definition. Let me see here. I wonder if this is working.
We're only able to see your Google Drive. I'm not sure if you're showing us something in a PowerPoint.
Yep. Let me see here. Sorry, it's just taking a little bit of time here. So I'm going to stop the share. And then let's see if I can do it here. And sorry, my computer, of course, is being slow. Okay. So are you able to see this view now?
Yes, thank you.
Perfect. And I'm just going to keep it zoomed out a little bit here. So I'm just going to go through. And then, so I talked about ideal youthful face features. And again, something to think about overall. On the left here, I describe the inverted pyramid shape that more encompasses a youthful female face. And as we get older, we tend to lose volume in the face. Gravity pulls things down such that, say, in an older female, that inverted pyramid flips and the lower face is heavier and less defined. And then again, this is kind of more higher level, but with facial contouring procedures, there's a spectrum of both surgical and non-surgical procedures. So, just think, when a patient is in my consultation room, it just depends on their goals, whether they want the most definitive results or they're scared about surgery. I always like to give a realistic expectations of what certain procedures can or can't do. On the non-surgical side, a lot of it is injectables like your neurotoxins like Botox and dermal filler. And the surgical side, there's definitely a greater range of procedures to help achieve or restore facial contouring, such as facelift, neck lift, chin liposuction, facial fat transfer, chin augmentation with implant, buccal fat removal, and facial implants. And it's always good to think about the profile view. Of course, we always look at each other from the front view. That's, the most common and the most encompassing view that we see when we look at a person. But the profile view really matters too, especially when it comes to jawline, neck contouring goals. And then actually just to take a small step back here. So as I mentioned, besides with a male versus female face, ideally, as I mentioned, the male face tends to be more square, especially in the cheekbones, that where the cheekbone should pop or have that prominence should be more medially compared to a female patient where it hits more laterally, the projection, and then the lower face should be more square. Of course, you can even think about nuances like the brows, how they can be more masculine or feminine in the face. For a male patient, it tends to be flatter with an arch more medially. So when we have nuance doing treatments such as even Botox, male patients may need a lot more, a higher dose to the upper third of their face because they are very strong in their emoting, so they can tolerate a stronger dose, and it's okay to make their brows flatter or keep them flat because that falls along the lines of a more masculine appearance. Any youthful lips, are characterized by adequate volume and height and looking very hydrated. But just know, if you're wanting to push more feminine lips, they tend to be fuller, especially more centrally in the lips as well. So this lovely patient, she came to me, was seeking, non-surgical treatments to help contour her face more. As you can see, she's very pretty. She has full lips. Her eyes pop out, but her face just looks like it lacks definition. It's kind of more like U shape. So what I ended up doing was I injected filler to her cheeks, as well as a little bit to her chin. And what I think is a nice, subtle yet powerful move is by injecting Botox in the masters. It's this muscle that's back here in your jawline. And by adding some projection definition here and to the chin, and by subtracting, by tapering the muscle here, you can see that her face has a more V-shape or inverted pyramid structure. So filler is a great option to restore volume, definition, projection in the face. Botox and other neurotoxin injections typically are used to temporarily paralyze the muscle so that it can minimize wrinkles, especially in the upper third of the face. This is, it's a non-FDA approved use of this injection, but this muscle, you might be able to see my muscles bulge out as they bite down. It's their master muscle. It's one of your muscles for what you use with chewing. So by temporarily paralyzing this muscle, it can help do two things. One, it can help relieve TMJ pain, like from up here. This is where I get Botox. So if you grind your teeth a lot, of course, the first line of treatment is still to wear a night guard. But the Botox here can help relieve some of the pain. And then by atrophying this muscle, it helps slim the lower third of the face, which is a nice result in the realm of facial contouring. I'm just going to show some pictures here. It's always good to see too, especially if you're on Instagram, you like looking at other before and after pictures of injectors or surgeons to see how their lateral or oblique views are as well. So you can see the chin is popping a little bit, the cheekbone, see how that there's a little bit of pop and that light hits the cheek with a little more lateral projection, but it's all subtle. It's very, so you can even make a case here on her profile view. You can't really see the chin that much improved. She wanted me to go conservative, so we only did a half syringe. So really she would need more if she'd want to push her chin out more. And then this very nice gentleman. So this is a good example of facial contouring from a male perspective. He's in his 30s. He feels like he was losing definition and his face was kind of falling. So you can see again, he's not like looking significantly much older, where he's someone that we talk about, a face over neck lift, but you can see that he also has like a rounded U-shaped structure of his face. It's softened a bit, and he wants to restore some masculinity to his face. When it comes to jawline contouring with filler, each syringe of filler is only a fifth of a teaspoon of product. So I really tell patients that they need to invest in a lot of syringes. So again, if you're on Instagram, it could be as much as 10 syringes easily to start with. So we ended up doing about 6 syringes. Each of them is about a syringe and a half of volume to work with. And so I ended up placing filler all along his jawline as well as posterior. So kind of opposite to the last patient, where I wanted to bring out the posterior area of his jawline to get that more square look. I also too wanted to elongate his lower third of the face, because this part of the face is shorter compared to these thirds of the face here, just to give more proportion and balance. I also saw the left side of his posterior jawline, there's some asymmetry. It was not as defined compared to the right side. So I placed more on the left side here to restore symmetry as well. And then I injected filler down in the vertical dimension to elongate his chin, as well as more to create some width and more square appearance to his chin. And you can see here too, so on the lateral view, he has more definition, his chin projection is increased. We have to also take in consideration, especially when it comes to adding, subtracting. This area here, he has some fullness, some fat here. So that will, in a way, hinder the amount, the extent of definition he can have. If he thinks about possibly doing some liposuction in the future, reducing this can really help his jawline a bit more in terms of definition. And so this patient, if you've been to one of the other talks, this is someone that I have used before to go over. So, she's a really fitness instructor, works out often, is really great, came to me, wanted the typical usual Botox and filler just help rejuvenate her face. So I had those goals in mind, but I also saw too that on the left here, even though she has actually, a V shape, she's got a lot of definition to her face. It's as if her face is actually more of the spectrum looking a little masculine, that, by achieving some filling in some areas, achieving some lift and definition, we can, use those treatments to feminize her face a little bit more, to soften it. So I did some Botox upper third of her face, harder to see because she's not making facial expressions in terms of reduction of her lines. She had some brow asymmetry. The left brow was a little bit lower, so I put some filler in the left brow to give a little lift. I only did a syringe total to her cheeks to fill it out and give a lift as well. And then a little bit along her jawline here to smooth things out. But again, that nice powerful move of placing some Botox and masters here really brought in the lower face a bit to help, make her face overall appear a little more feminine, more tapered. And then you can see here, again, all these subtle results. You see this is smoother here compared to over here. Her cheek, again, kind of has that, is filled in more projected. But she just looks more refreshed, more feminine, but still her. And you can see similar findings here. And then just want to go review a couple of cases here. This is more from the surgical side. So when I do this talk, I have focused more on the non-surgical side, but again, there's a spectrum of procedures, and that means spectrum of realistic expectations out there. So there's only so much that injectables like Botox and filler can do, especially when you need to do things to the face or neck area to subtract. The only thing that can really subtract from a non-surgical standpoint is some Botox back here. So this patient, she felt like her face was rounded. A lot of patients who desire having buccal fat removal feel like they have really round, chubby cheeks. So what we ended up doing was pursuing a surgical procedure, a buccal fat removal. It's very in vogue now. If you know of or follow Chrissy Teigen, I think she recently revealed that she had this procedure. So what I tell patients, if you wish, when you're looking in the mirror, you are sucking in your cheeks a little bit and you wish right here was a little bit more was a bit slimmer, more contoured, you can take a walnut size amount of fat right here. It's something that I can do in the office setting under local anesthesia, like going to the dentist. But you end up, seeing results within 2 to 3 months that you can see just with that subtle result. It slims the face in here, brings it in, and she has some more contour to her face. And then finally, for our older patients, where again, only Botox and filler can do so much, sometimes that more definitive surgery will get the most dramatic results. I do think of facelift and neck lift, even though they're classic aging face procedures, what they do is, you help to resuspend the skin and the deeper tissues to be able to achieve a more youthful appearing face. In that same thought, that is what we're doing to achieve facial contouring goals. So this beautiful patient, again, I've talked about her before in other presentations. She first did upper eyelid surgery with me, and then said to me, I'm bothered by the neck area, the fullness there. And so you can see on the left here, with aging, their lower face, there's laxity there's fullness, and we end up doing a facelift and neck lift. And you'll see in the pictures next that now she has an actual, you can see her jawline. She actually has a shape to her jawline. It's less heavy appearing here on her profile view. She actually works out a lot. So genetics plays a role too. And for her, we help achieve the neck she never had, to achieve that result. So so that's the end of going over some before and afters here. Again, I'd like to open up to questions. Okay, great. So I have a couple questions here. So did you take any business classes, or did you pick it up as you went through the process of opening your own practice? That's a good question. I have some colleagues who say in medical school you can apply to and do business school as well. I would assume it's 2 years or 1 to 2 years, but it's something where, I knew of colleagues where you can say do all medical school and then do business school at some point, or do business school first, or you take a break, from your, after your 3rd year, I believe, and then do business school and come back and finish medical school and apply to residency. I think having that extra knowledge, in perspective is really helpful, especially if you know you want to open your own practice or be more on a management level, more so than clinical medicine. At the same time, though, a lot of it, even just me, my training and residency and fellowship, you learn much more once you're in it, in the middle of, seeing patients, taking care of them, seeing the results. You're going to have complications, managing those issues or other issues with patients. There's only so much you can learn from being in a classroom or having a textbook. For me, I just picked it up as I went. I'm really grateful for my mentors that I have, including one who opened up his own successful practice on Michigan Avenue in Chicago, and he's been through phases of his career. He used to own a business, marketing company. His practice has been bigger and smaller at times, and that was where I gleaned more of the business or marketing side within a year. Besides more of my surgical training as well for facial plastic surgery. I'm grateful to have colleagues around the country, including I'm in a small group of female facial plastic surgeons where we meet virtually. And these are just ones in private practice where we go over any issues or questions, any issues or questions people have, or we have certain topics with speakers like such as HR, liability, social media. I can always quickly email or text any of these colleagues, which is great. In medicine, it's all about continuing education. So I think attending meetings is helpful. There's some out there that just have like a business track for you and your employees too, to learn more of the business side. So, right now it is picking up as I go. I was an independent contractor first, now for 2 years before I opened my own practice. So there are things I've been doing on my own, such as managing having someone manage my website and working on my own marketing, my Instagram, that, that it was nice to get that push from my colleagues and friends to say, Tina, you're doing a lot of this already as your own boss. You should just really take the extra step to open your own practice. How do you judge when you need to intervene surgically versus opting for non-surgical alternatives? Like, is there some sort of threshold criteria? That's a good question. So, a lot of it relies on the patient themselves and their mindset when they come in. So, even if it's an older patient who clearly needs a facelift, if they're not there yet mentally to undergo a procedure with general anesthesia, they don't have the time for downtime, it's really hard for me to convince them. What I do like to do though is, again, I don't sugarcoat anything. I want to give realistic expectations, right? I don't want to tell them that doing a filler liquid facelift is going to be equivalent, because then that affects my outcome and patient expectations. So if, say, they are just not ready for surgery yet, I will tell them, okay, this is what the non-surgical alternatives can do or not do. I'll put it, in their mind so they at least think about it. And especially if they pursue the non-surgical, to see what it can do or not. And then say, the surgery, this is the most definitive. When you're ready to talk about it or pursue it, I'm here to, pursue that. For some patients who are very open-minded, say if it's like this fullness here, and again, I'm a surgeon, so I like to operate, I like to be more definitive. A non-surgical alternative to taking away the fat hair is actually Kybella, and it does create permanent results. So, what I usually do is I do an objective assessment, and then I relay the possible options. I always talk about too, even if the patient set on surgery too, just to make sure so that they know it's all informed consent is very important in the practice of medicine, not only legally, but again, for your patient expectations and to give them the best care, that they know all the possible options and risks with them. I'll tell them about Kybella. I talk to them to let them know what the possible risks, downtimes, benefits between the different procedures. And in that way, it helps the patient decide what they feel is best for them, or even if I know what's best, to help guide them down that path. Because ultimately, for any procedure I do, I need patient consent. Patient needs to be on board for that. And then there's certain things, like say patients are just bothered by wrinkles, I can't really do surgery per se. It'd be like, oh, does Botox help it? Does laser resurfacing or other skin resurfacing procedures? There are certain types of issues that it's a narrower spectrum of procedures that can maybe help. Um, are the surgical procedures most often outpatient? Where do you perform your own surgeries? Do you have your own surgery center? So yes, for me in the plastic surgery realm, and most of my patients are healthy. This is elective procedures. They are outpatient, all of them, and the where I practice is a surgery center. So patients typically go home the same day. I do not have my own surgery center. There are a number of surgeons in my specialty as well as others that do decide to open a surgery center nearby or in that site of their office. And I think from a revenue generating standpoint, it's a good idea. I'm just not there. It just seems like a much bigger ordeal because you have to, not only have the extra office space, you have to then get accreditation, you have to manage your, and hire employees to, run it. You have to purchase your equipment. Sometimes, it's always whatever it is it worth your time and the money you make from it? For me, I'm okay with a surgery center taking care of all of that, and I just book and bring surgeries there. What drew you to facial plastic surgery in particular? So, as I mentioned earlier, I have my own child reconstructive surgeries that were craniofacial. So I was drawn to plastic surgery on the reconstructive side of, seeing the positive impact my surgeon had on me, and how immediate that was, and that decisive role he had. And ultimately, I rotated on both ENT, which I didn't know much about going to medical school, and plastic surgery. I really like the head and neck focus regardless. So I would have been fairly happy as a general ENT surgeon, even if I didn't do facial plastic surgery, but just this focus of the head and neck, the intricate anatomy and details, like you have cranial nerves, you have small blood vessels there. Such delicate surgery. It's good balance of clinic and operating. The personalities of the surgeons I feel like I click with best in terms of, they seem smart but very balanced from a work-life perspective. Plastic surgery, it's a little bit longer training. It starts with at least 6 years if you're on the straight through track, and then doing fellowship could be 1 year, could be I think 3 years for craniofacial. So I always thought about it. I would say I didn't have as much of the how do you put it like that? Um, I guess uh, I thought about it. I think to make that sacrifice, become a true craniofacial surgeon, it would have taken a lot longer. I wasn't ready for that, especially when plastic surgery, you learn about doing surgery on the entire body first in general surgery. And there's aspects of it that just didn't appeal to me as much, like hand surgery, breast surgery, abdominal surgery is fine, but not as much of a calling compared to anything facial surgery. Along with having an education background in business, would you recommend also looking into studying law in combination with your medical residency studies? So, I think this would be a good question to ask someone who has a law degree or maybe has a background in medical law. Again, I think for education background in business, you don't necessarily need to formally have an MBA, but yes, by the time, I think there are, things I wish I knew better. But again, it's learning from a book, right? Versus from experience. I have a great CPA attorney. He does helps, fulfill legal things as well as my accounting needs for me. He's a good resource. So it's sometimes too that you just have to find the right people, just like in your practice, that you can rely on, who are doing a good job to take care of things that you cannot. So for studying law, I would say, because it's such a different path, right? It's additional 3 years. You have to do this other testing. Um, and again, it's using that different type of brain, where for me, I wouldn't do as well because, it's writing papers and again, I'm a very straightforward, like science and math are my forte. So for that, I would say if you are really interested in medical law or somewhat practicing in a legal capacity or being a lawyer, I think it's tough because those two career paths are just very different from each other. At least business can be applicable for someone who owns their practice and wants to be clinical. So I would just recommend, if you can find someone or reach out to, somewhere that has a medicine and law program, so that you can figure out, those individuals who pursue both degrees, what they do and why they did that. What advice would you give for a person that has uneven double eyelids? So this is something where, we need an in-person evaluation to see the exact nature. Now, I would say, especially if it's a medical issue behind it, I do eyelid surgery, but I only do being the bread and butter for those with, you know, heavy eyelids, because they're getting older, very classic surgeries. My oculoplastic surgeon colleagues would probably be better suited to see this issue, just because they are eye surgeons first. They train in ophthalmology, and then they did a fellowship in facial plastic surgery. Uneven double eyelids, again, I need to see pictures or see the patient in person, but it could be a matter of someone having eyelid ptosis, for instance, where one eye is just, the eye aperture is smaller because the eyelid is more downward turned. I don't perform that. I don't perform ptosis repair. Again, it's classically performed by ophthalmologists, oculoplastic surgeons. There are some facial plastic surgery colleagues who do it, but just for me, where I didn't do it, a matter of millimeters or less makes a big difference for these patients, that I think, if that patient came to me, I would likely refer them to an oculoplastics colleague. What do you recommend we as aspiring doctors do if we're interested in your field? Should we pursue research to stand out? So, it's a good question. I think the easiest thing, just to make sure, or have a taste of it, is to try to shadow. So if you can, to find local plastic surgeons, or, through a nearby, school of medicine, reach out and see if you can spend, whether it's a couple hours or a half day or full day, to be in their clinic, to be in surgery with them too. Like, you want to make sure, are you okay with being in a operative environment, seeing blood, operating for hours at a time? It takes a certain mentality or stamina there, so and to figure that out, and if working with your hands, and doing cosmetic or reconstructive procedures appeals to you, versus, like, say, patients who pursue more, like, say, medicine or pediatrics, they spend a lot more time figuring out, the different medical problems patients have, and talking to the patient. So it's a different skill set. And then otherwise, if you're fairly interested, again, I would still say be as open-minded as possible. Just because you never know. I didn't know much about ENT until I reached medical school. But once you're in medical school, then I think that's the time to then look into really getting to know the plastic surgeons that are at your school, like through the plastic surgery department, and pursuing research opportunities with them, or the residents, gaining more shadowing experience, eventually rotating with them. That's the time. I would say no need to really worry about that unless you have connections to doing research as soon as an undergrad. I think in general, for high school students, undergrad students, just to get the exposure in general medicine. Do you want to do medicine or not? Is there anything else besides medicine that you are as passionate about? Because if you are, I would, strongly recommend you consider it, because medicine is such a, narrow-minded track, and it requires a lot of time, finances, sacrifice invested. And then once you're in college or pre-med, you're doing well, and you're applying to medical school, you could get involved in research to help with your application. Your research history will help with your residency application regardless, but it's okay to not be as singularly focused until you're in medical school. Do you have a lot of recurring patients or new patients most cases? So that's a good question. For me as a young surgeon, especially building my surgical practice, so I want to draw on the new patients, right? Because I need to build that volume, especially starting kind of from scratch again, the new practice and location. So I'm always, we need new blood, we need new patients. I'm happy the patients I typically draw, are those who maybe younger, who seek natural results, who are of various ethnic backgrounds, even just different sexual orientations, which is great to show. I think that is a testament to, I want to be as approachable surgeon as much as possible. So it's nice to, see that reflected in my patients, because it's a big deal for them to trust their face in me. For me, the challenge more is to attract older patients, especially with aging face surgeries, because, they're 10, 20, 30 years older than me. That's going to be a challenge in general for me, that I'm a surgeon who is young and looks young. At the same time, though, once I hit, a good balance point, if I've made it, where I have a solid reputation and I have, a steady, stable flow of patients, I would be fine. And I do have a lot of recurring patients, those who get Botox every 3 months, filler every 6 to 12 months, because if you only really need patients to keep coming back, especially from the non-surgical side, or those who've done one surgery with me and then want to do another procedure, to those are your patients who, have liked your results, they trust you, that relationship is there and easy. And so I don't mind at all, to be able to have those recurrent patients in our practice. In your field, do you ever get patients that ask about dark circles? So that's all the time. It's one of those issues that I draw a lot for patients, especially since I do a good amount of filler. And it's one of the most challenging but rewarding, issues to help improve if it's the right candidate for a filler. So I'm not someone who loves doing lips, for filler. I love doing filler to here and the cheeks all the time to get that rejuvenated look, that they look like they got more sleep, they came back from vacation, they look refreshed. What are the cons of having a private practice in the US? Particularly, is it competitive since there are many hospital practice options for patients to choose from? So, okay, yep. So possible, let's see here. Downsides of practice. Yes. So in general, when you are a plastic surgeon, even if you say, okay, like, my patients pay cash only, my income is predictable from that aspect. I don't deal with insurance. But at the same time, like, I have to prove that I am good at what I do, right? And that, patients appreciate my treatments and the results. So especially as someone as young as me, I mean, I wasn't brand new, which is good, but it is kind of intimidating to kind of to open your own practice, and you can't just open it and expect just patients to walk in. You have to invest in something, whether it's networking with other practices, businesses, doing marketing. So I'm in the Philadelphia suburbs. It's very competitive. It's not like New York or LA in a good way, but say for instance, like rhinoplasty is a highly sought out, surgery. I'm still trying to work on getting more patients because that's what I trained in my fellowship. I have attracted patients from more other procedures that I don't complain as much about, but so that's just one challenge there. My rhinoplasty practice has not been as robust as I like, but sometimes you just have to give it time. Let's see, cons of having private practice. So yes, if you join like an academic practice or like a bigger hospital practice as a plastic surgeon, you already have an in-house or inherent referral base. You have someone taking care of your marketing. So it's there for you. You're already seeing patients, from day one. So it's nice. But at the same time, you have to think about other challenges. Like, because you're an employee, you don't get to call the shots in terms of, oh, this is how I exactly want to market myself or the procedures I do, or this is how I want to, what I want to do in terms of my own website, my own brand, my hours even. Okay, we take insurance, which is fine, but you don't have much control about your compensation there for insurance cases, or even too, like for what you get paid as an employee, because there's overhead. For me, yes, I have to directly pay for the overhead for my business, but everything that I bring in minus overhead goes to me. It's not just a percentage. In your medical journey, have you been able to see any pediatric patients? So yes, so definitely in medical school, pediatrics is one of the core rotations to rotate through, and then you rotate on other medical specialties related to pediatrics, like say pediatric oncology or cardiology, and then For ENT, my residency training, because it does cover adult and pediatric disease, I did have specific rotations at the Children's Hospital, so related to pediatric ENT issues. With classic and two, under ENT, you could do an extra fellowship training to just be a pediatric ENT surgeon. The surgical issues or procedures that we usually perform in pediatric patients include, tonsillectomies, adenoidectomies, placing ear tubes, doing bigger ear surgeries for those patients with certain issues like cholesteatomas, possibly sinus surgery, and a lot of patients with congenital issues, whether they need a tracheostomy tube, they might need reconstruction to the airway. Some of the, as I mentioned, cleft lip, cleft palate, some of the either pediatric or facial plastic surgeons cover that, the congenital issues. So yes, it's not like, you have to train in adults, and you can become a pediatric surgeon only if you do the extra fellowship. So, just keep that in mind. But yes, I've gotten a good exposure to pediatrics from med school and then my residency training as well. What other questions does anyone have? I don't know if there's any other questions from the YouTube.
That was all of our questions. Thank you so much, Dr. Ho, for coming on again and presenting for us, and also for answering all of our questions. It was a pleasure to have you again.
No worries. Yeah. So yeah, feel free, please. I'm going to put my Instagram handle here. So Dr. Tina Ho, again, would love the Instagram loved and support. You can see more of what I do, kind of me day to day on Instagram or my website too. But thanks so much for having me. Appreciate it.
Thank you so much. Everyone, make sure you check out her socials. Her Instagram is at Dr. Tina Ho. And also, if you go to our most recent post, you'll see her tagged. So you can get to her Instagram from there. Also, just to let you know, I'm about to post a Google form in the chat, everyone. So please fill it out within the next 30 minutes. Again, thank you so much.
Thank you. Take care. Bye.